Hello everyone. I'm Pete, and I'm ambassador for No ALL. Yeah, I've been asked to speak a little bit about diagnosis and hindsight. So about the things leading up to a diagnosis, the signs and symptoms, um, a little bit about what the common ones are, and also the ones that like fly under the radar and don't get spotted, don't get picked up as easily. So yeah, if you wouldn't mind going on to the next slide, please. So yeah, what to think about during this presentation. So think about your experiences with ALL diagnosis. So obviously, if you are a ALL patient or caregiver, or if you're a medical practitioner as well, think about those routes to diagnosis that happen. So what are the early signs and symptoms you wish you'd spotted, or you wish had been spotted by a healthcare professional? What things you think yourself and the general public need to know about in order to help more effective diagnosis? What actions can we take to work towards quicker and more effective diagnoses? So I'm going to speak a little bit about my own diagnosis journey. I'm sure a lot of people might relate. I was told at the time that mine was kind of a textbook example diagnosis. So yeah, I'll speak about mine, and while I do that, if everyone kind of reflect on their own experiences, and see if we can find some underlying themes there. So I was diagnosed with T cell ALL in 2013, 18, and I was studying for A levels. And for those of you who aren't from the UK, that's the big exams and coursework you do in school just before leaving, so at the age of 18. So I started to feel unwell over about 2 or 3 weeks. And that started with first was a pain in my shoulder, and then I was having headaches. I was quickly exhausting for exercise. I was a bit pale. I had visual disturbances, so I don't know if you've ever had it when somebody's like shone a light in your eye, you've got a bit of a blind spot. And I had that, which I knew wasn't right, and pinprick rash on my ankles. If we can go on to the next slide, please. Oh, sorry. So um, my doctor took a blood test, and when all that happened, and I was diagnosed less than 48 hours. We could say on this slide actually for a second. Um, so at the point of which I had the headaches and the exhaustion, I was thinking, as you would, that this is a symptom of overworking, of being stressed, sleeping enough, that kind of thing. The exhaustion, I thought, or maybe I've really got unfit with all this time I've spent studying and not exercising. The pale complexion, that was actually picked up by other people, and I brushed it off because I hadn't noticed it myself. But it was the visual disturbances and the pinprick rash that I knew was wrong, and the people around me recognized as not being right. And that's the point of no, actually I went to the doctor during the headache period. The doctor said it was similar to a migraine, but not a migraine. Put me on migraine tablets, and then the working theory was that the rash may have been an allergic reaction to migraine tablets. Um, so yeah, if we could go on to the next slide, please. So what these signs actually meant was the headaches, the exhaustion, and the pale complexion were all symptoms of anemia, and the visual disturbances and the pinprick rash are symptoms of low platelets. And they were both caused by very tiny hemorrhages, basically, that created that. Next slide, please. So I touched on this a little bit lightly, but I think these weren't picked up on because most of them were mundane and common symptoms. Um, of They're symptoms that I had before and I had since. As I said before, they're easy to explain away, and I think we're all a bit guilty of this, just saying, "Oh, it's just exam stress, just overworking, it's just tiredness." I think from my doctor's point of view, we're always told that, that in these communities we're in the UK, that a GP probably sees one young person with cancer during their career. So from their point of view, it's much more likely that it is something mundane and something common than it is an 18-year-old with cancer. And as I said, it was only the later, more rarer and more complex symptoms that were a cause for concern for myself, people around me, and my doctors. So, in reflection of that, I've kind of thought about ways in which we can work with healthcare professionals for more effective diagnosis. So, if I, in hindsight, truly, I think a lot of my symptoms were very mundane, not unusual, but as a group of symptoms together, that's when they're a cause for concern, and that's when they're indicative of ALL. So it is important, and I did kind of do this in the end. It is important that when a patient sees their healthcare professional, they explain everything, try and give the full picture, not just the one thing that they're concerned about, but maybe the other things which they've already explained away and they don't see as relevant, in order for the healthcare professional to pick that up. And likewise, from a healthcare professional point of view, it's also, would be really, really helpful if they can work to try and get that fuller picture out of their patients, to ask the right questions, to find out if there is any other signs, symptoms which may be indicative of a bigger problem. And something which I think we can all do as patients, as caregivers, is share our experience with diagnoses, the signs and symptoms that we had, share our stories with the wider communities, with healthcare professionals, in order to get some of these signs and symptoms recognized. And the other thing which I'm really, really pleased that my doctor did was err on the side of caution. He took a blood test just in case, and it ended up being the blood test that basically got me my diagnosis. So cautionary tests and examinations um, can have life-changing implications. So I think that is something which, where possible, it is always helpful to do. And even now, if I'm feeling a little bit unwell, I just ask for a blood test. So the that's kind of what how patients and healthcare professionals can work together. But for the public, it is also important for them to know that these non-serious symptoms together can be an indicator of something serious, especially the symptoms of anemia. So the things that I express, such as pale skin and tiredness, that needs to be diagnosed and treated by a healthcare professional. I had recently had somebody actually say to me, "Oh, I think I'm anemic, so I'm just going to change my diet a bit." And I said, "No, if you think you're anemic, you need to see a doctor." Um, so also the more obscure symptoms of ALL, such as bruising. Um, I think there's a lot of other things. Everybody really knows the symptoms of a stroke, and they know the things which are unusual and what to look out for. I don't know anybody who knew of this before I was the case. So yeah, it's really helpful for the public to know what some of the more obscure symptoms look like. The other thing is a lot of the time patients, the public, everybody know themselves better than anybody else. And you also know if things can are normal for you, or if things are not normal for you. And if something doesn't feel right, if something is not normal for you, really seek professional opinion. If that doesn't work and you're still not happy, seek a second opinion. And you do have a right to be heard. Even if you're not right, you're not correct in your assumption that there is something wrong, you do have the right to have that seen through. So really now I'm going to open up the discussion to everybody else in the room. Um, Obviously I've spoken a little bit about my diagnosis. Is anything similar or different in your experiences? Are there any other signs and symptoms that you think healthcare professionals should pick up on quicker? Are there any other symptoms that seem to fly under the radar of healthcare, and why do you think this is? What signs and symptoms do you think the general public should be made aware of? Thinking about kind of the culture around, and I'm very aware that when I'm speaking from I live in the UK, and our healthcare service is a lot different to the rest of the world, but saying that ALL is not just a UK problem, it is a worldwide disease that affects people. So it is really good to hear other cultural viewpoints on that. Um, and also that's something to very much be aware of, with speaking about what we can say to the public is something that, that needs to be sensitive towards. There's not a one size fits all advice really, because I'm lucky where I am that I can challenge my healthcare professional. But that is definitely something which I think, as you say, is really, really helpful if we can empower future generations, or just, the public as they are now, to be challenging their healthcare professionals. And as you said, also to for healthcare professionals themselves to not be offended when they are challenged or when a second opinion is sought. So thank you very much for that. Michael.
Thanks very much for sharing your story there, Pete. I think that your description of your experience is one that many people who've had ALL, or in fact other types of leukemia, would really be able to relate to. I think you made a number of really important points in your discussion. Definitely the combination of tiredness from anemia, bruising, or easy or bleeding from low platelets, and high temperatures, so fevers from having low neutrophils, are quite common symptoms that we do see in people who have ALL. One of the difficulties there from the doctor's perspective is that a lot of these symptoms can occur with other much more common conditions. For instance, many young people with ALL will say, I'm feeling really tired. But if a doctor hears tiredness, they'll think of the more common causes for that, such as you're working really hard at the moment, um, or somebody might have something like an underactive thyroid, or they may have depression or other mental health issues that are causing tiredness. And a lot of these things are much more common than what leukemia is, and doctors are taught to uh, think that common things occur commonly. The problem is, of course, that uncommon things do occur. So it's really important that doctors and other health professionals do consider cancer, particularly, as you say, when somebody presents with a combination of these symptoms, such as a combination of tiredness and bruising, or a combination of tiredness and high temperatures, or in younger children, having sore legs or refusing to walk. Well, that's not a common symptom in older children or teenagers or adults. Often 3-year-olds with ALL will be reluctant to walk, which is a real red flag for us as doctors. I think one of the other challenges in terms of diagnosing ALL and other acute leukemias is that the symptoms often develop over a very short time frame. Many of us in the community think that cancer is something that gradually happens over time and gnaws away at somebody. But as you highlighted in your description, there's often only a couple of weeks of symptoms in the lead time. I think one of the other really important points that you made is that often people don't think about cancer in young people. And this is where there's a real opportunity for advocacy by groups like No ALL, but also groups like the Teenage Cancer Trust in the UK, Teen Cancer America in the US, and Canteen in Australia. So groups like that can help educate not just the community, but also health professionals as well, that it's always important to think about cancer whenever there's a combination of unusual symptoms in a young person.
Thank you for that, Michael. That's really helpful as well. And also to you picked up on a couple of the more um, symptoms which aren't picked up on. And I think, you've raised a very valid point about how easy these are to explain away a lot of the time. And I think really in a um perfect world, you would have a very proactive healthcare professional who is on it and, asking all these questions and trying to get to the bottom of it. But the reality is that a lot of the time, wherever you are in the world, the healthcare service is probably, not that, doesn't have the resources to be that proactive. Which I think as well is something else that you touched on, which is why it's really important for um, both the public, the patient, and healthcare professionals to work together to try and do this, and that can be done through stuff like advocacy and raising awareness as well. So thank you.
Sorry, Pete, just one other comment that I'd also like to make is that it's really important if somebody's symptoms don't go away, that they go back to the doctor. There's so often people think, I've been to the doctor said it was all just because I'm tired, I'm working too hard, I don't need to go back. But in actual fact, if the symptoms are not going away or if the symptoms are worsening, the doctor is expecting that that person will come back and see them. So I think that's a really important message that if things aren't right and they're not going away, go back and see that doctor again.
Yeah, that is absolutely right, and that is another thing that really we can try to promote in the public and for patients. And really that's something which takes a bit of guts to do, I think. Like especially me as a young person, I know many young people who would just be be told, oh, you're just overworking, and just treat that like that's a complete diagnosis, and that they never need to go back to their doctor again. It comes back to what Lydia said as well about empowering these people to know what they can expect and what they can get from their healthcare professionals. Thank you. Do we have any other comments, questions, thoughts? Oh, James.
Hiya. One key point I think worth mentioning with regards to diagnosis and something that it doesn't particularly affect me because of my gender, but one thing that I notice has been a recurring theme from quite a lot of the female patients that I've been friends with and have known for many years is the disregard, I think, for symptoms because of young women's experiences going through puberty, having their periods, everything to do with the menstrual cycle, affecting women's hormones. That's typically the first point of blame for healthcare professionals to be like, ah, well, it's fine. You're just having female problems. And it's like, it's always a difficult conversation when you realize that people's not only diagnoses have been delayed, but also have been severely impacted and worsened by the blasé reaction to young women having issues around their own health. And then also there's quite a lot of pushback when women will repeatedly go back to the GPs, especially in the experiences that I've heard, in still having the same experiences. I think, Michael, you mentioned, having the wherewithal to go back to the GPs, to go back to your healthcare professionals. That it seems that when women continually go back again, there's a much lower chance of them being still taken seriously. So I think it's just a question out to the group of how do you feel that that can be solved? Because I know that that's still been a problem for many years, and I know it's still prevalent in some places still.
Thank you, James. That's a really valid point, I think. And again, that we're talking about cultural differences, and that's a cultural difference, experienced within cultures and communities themselves is the difference between how men are treated and how women are treated, or how different people of different genders again are treated. And I think maybe as well that is something which, when I said about seeking a second, third opinion, you know, um, it would be great in a perfect world. I think people would be able to say, I'm not happy with this doctor's attitude. I'd like to be seen by a female doctor, or a doctor who I think would take my experiences more seriously. But yeah, thank you for bringing that up. And is there any more thoughts on that? No? Is there oh sorry, carry on, Mike.
Well, I think one of the challenges when people do go back to a doctor with the same set of symptoms is that we know that doctors sometimes are subject to something which we call confirmation bias, which basically means that if you've already thought that a set of symptoms relates to a particular diagnosis, then we're more likely to try and force those symptoms to meet what we think is causing it. And I think this is why, if you're going back to the doctor with the same set of symptoms, it's important for the person to ask the doctor, could this be something else? To almost prompt them, is there any other possible thing that could be going on here? I think if a young person is finding that they're just not getting the engagement that they'd be expecting from their doctor, and if they choose to seek a second opinion, it's really important when they do go along that they give that really clear history. I think, Pete, you described earlier on just how important it is to say all of the things that are happening and not assume that the doctor will know the right questions to ask. So really providing that very clear history is such an important thing to do.
Thank you, Michael.
Hi, thank you. Thank you for a really interesting discussion. I should point out I'm not a medical doctor myself. I'm in research, but one thing that has struck me by the conversations that's been happening here is that this area is probably in need of further research. And one area that might be relevant is using some kind of artificial intelligence or machine learning algorithm so that GPs, if they see a certain constellation of symptoms, are therefore more likely to be prompted, as you say, Pete, to do that blood test. And I know that there are some research groups in the UK that have been looking at, diagnostic pathways and ways of improving that system whereby you go to your GP, and what you want your GP to do is do that blood test and do it not all the time, because of course, as Michael's pointed out, a lot of these symptoms are very, very common and often causing something else. But maybe there can be some research which will help narrow down the kind of diagnostic window so that GPs feel more comfortable about ordering that particular blood test that will be that gateway to a diagnosis. And so hopefully there'll be some research around that area. I mean, certainly the NHS does have some unique features in the sense that it captures all that information about all the individual GP appointments. And those databases are, centralized, they're nationally available, and hopefully can be some work that will come out of that. And maybe, someone on the call or someone who listens to this, online might know about more research that the group can learn about. But I think clearly that's probably the way forward to make sure that diagnosis is faster and more precise.
I think that's an excellent point you make about the advances in technology and how that could potentially aid in this. And I think while not all of us will be in the position to be able to implement that, it still does speak to the power of providing your GP with as much information as possible. But I think that is definitely, one of the few things that I'm excited about with AI is, the implications like that. So yeah, thank you for bringing that up.